As these negotiations have been going on for months, and caught in the middle are patients who may have to drive a lot further for their care. At 5 p.m. Wednesday, Yavapai Regional Medical Center went off network.
We are really sorry that this situation is occurring.
We sat down with Yavapai Regional Medical Center CEO Dr. Anthony Torres, who says his hospital is a nonprofit that requested a rate increase less than the rate of inflation.
We didn't walk away from the table. Blue Cross walked away from the table.
In statements, Blue Cross Blue Shield put the blame on the hospital, saying Yavapai Regional is the fourth highest cost hospital in the state, charging twice the average rate of hospitals in Phoenix.
You know, our costs may be a little bit higher, but again, the cost for us to recruit and retain doctors here and nurses is much higher also.
And I don't think there's a villain here.
Dr. Dan Durkin is with the University of Arizona. He says rural hospitals do cost more to operate because of the cost of getting employees and having more uninsured patients. But normally, an agreement gets worked out.
If not, unfortunately, the cost starts accruing to the individual.
Now, who this impacts will vary. Patients needing emergency care will still be covered, but those needing things like elective surgery will not.
I think from a patient's perspective, the term elective surgery is a little misleading.
In all, Blue Cross Blue Shield estimates 11,000 of its Yavapai County customers will now be out of network at this hospital. But for Durkin, this lack of agreement shows not broken companies, but a broken system that even allowed this to happen in the first place.
It seems like there's a much better agreement that could be made that really works with the patients at the center.
Now, negotiations between these two sides can still occur. But in the meantime, we have information on whether or not you're impacted and what to do online at 12news.com. Michael Doudna, 12 News.